We've got here a prescription for pill colocynth compound, we called this. It was a purgative type treatment and it was a very popular type of treatment for most ailments in the 1950s.
In our apprenticeship system, when we started work, we were like, the apprentice is now in a kitchen. You do all the dirty jobs. You'd be washing your bottles, you'd sweep the street, you'd
go for lunches?
Yes, you have to get everybody's lunches.
When you're in the city, you run to the warehouse.
Then you
Brian, go to the DHA, and you come back, 12 minutes. The record's 10. So that made you go faster next time.
We were brought into the profession in the late 1940s, and by then dried herbs were not being used really. They'd progressed onto tinctures and infusions, which in a lot of cases we did have to make from the dried herbs, but we would make up a big bottle of the tincture or the infusion and then decant from this into individual prescriptions depending on how much the doctor prescribed. We start off using some of this preparation here, which is called rhubarb powder, compound rhubarb powder, and I'm going to make this into a form which is malleable so that I can produce a spherical dose prescription for it, and then I've got to make it into a fairly firm one which will keep its shape, but which it has to be just of the right texture so that it can be moulded and hold its shape, and yet it can be, we don't want any sharp edges or anything because we've got to have it nice and smooth and well coated by the time we finish. We had all sorts of tricky things to make up. I remember when I was at my apprenticeship up at Castlemaine, there's a curse of a job they gave me. There was one of the old ladies used to come in and get some pills, and it was, they were called Hyra pills, H-I-E-R-A, and then capital P-I-C-R-A, yeah. And they were largely purgative sort of things. I used to make these blessed things up every month, and it used to take about half an hour. I think we get about 2 and 6 minutes worth of it. Strangely enough, I can remember using concentrated hydrochloric acid, and you could rub that on your hands if you had any calluses or warty sort of things.
Come away.
It'd eat that away. Wouldn't harm healthy skin at all. So the first part of the preparation consists in kneading in the mortar and pestle with the syrup of glucose, which is the agent I use to make it of the right texture with a little bit of liquidity, and yet it's got to have a fairly firm, dry consistency because of the powdery nature of the ingredients.
all the old diggers that came back, from the war, that had been in the jungles, they used to have all these terrible ulcers. And in those days, when the ulcer, the stuff came out of it,
Tropical ulcer type thing.
you'd clean it with Usol. It used to sting, but that was their way of treating it. Nowadays,
antiseptic.
Yeah, but nowadays, that stuff that comes out, in actual fact, that's the way the body heals. And so now you put a pad on that holds that stuff in, and the whole thing heals. We work this for quite some time until we've got a consistency which will just start to peel away from the inside of the mortar, and then I know it's about of the right consistency. I remember one of the tricky things that we had to make up was if you had a kiddie with an abdominal problem, the doctor would prescribe a mixture with either castor oil or olive oil in it with some dill water, which is an ether, one of the volatile oils related to aniseed, and we had to make the oil into a miscible form, so that it would stay in mixture with the water. So we had a formula for that. We called it a 4-2-1 formula. Remember that? 4 parts of oil, 2 parts of water, and 1 of gum acacia. And you'd have to mix that first so that you get your primary emulsion. And you knew when your primary emulsion was right when you could sort of hear this clicking sound. Yes, and then you knew you could start to add more water gradually and get to form the homogeneous mixture.
Used to be a joke amongst, I think Greg did this to me, you'd ring up your fellow, "Oh, it's Dr. Smith here. I want some pills today, please. Arsenic, so on, so on, so on." And they were white, you see. And invariably it was your mate ringing you up.
I bet we've all fallen for the trick too of the unwary. I mean, it probably only ever happens to us once, but everybody felt it once. Somebody prescribing aspirin with Seneca pneumonia.
Oh, yeah.
See, the aspirin reacts with the ammonium. Fizzes all over that place.
So we have to make the prescription medication into a tube, much the same as a long cigarette, and we roll that out into a nice even cylinder, and then we use the pill machine, which is actually a cutting device, which is then going to separate this little cigarette into 12 equal parts, which will be the exact way of getting the right amount of medication into each pill by making it into 12 equal sized portions.
Most of the things that we put in our medicines were in powders, weren't they? Really,
Powders or liquids, yes.
But we used to have to make up our APC. That was probably
calamine lotion.
The mixture that if a doctor didn't know what was wrong with you, he'd just set you up to get some APC.
After having cut the roll into 12 portions, we use some talcum powder here as a lubricant, so that the 12 little pieces can be sort of rolling around on the bench. We have to roughly shape it into a spherical shape, and from that rough shape we then put it under the actual roller, and we're gradually and gently shaping those into more accurate spheres. When we've got our 12 little spherical pills, we've got a light dusting of talcum powder on that, which is quite harmless, and we just set that aside for a couple of hours then to harden, so that we can put it into the little pill box for subsequent labelling and issue to the poor unfortunate that needs the treatment.